introducing you now.
No, I'm just a clinical psychologist.
That works.
That works, or a therapist.
Good to see you. Always looking bomb.
Thank you.
Hey, you've got a lover therapist, a brainy babe who knows how to style herself. That fashion is on point. It's on fleek.
Thank you.
So we have a great discussion here, and I think this is also a very new kind of version towards mental health issues that we're going to tackle, because we don't really look at it that way, that there's a correlation between substance use and then of course you've got the issue of mental illness. But first, let's start off with the substance use disorder. For you, how do you describe it?
Well, substance use disorder is actually a mental disorder. So this is a disorder that affects how you behave and how your brain operates, such that you can't operate without taking in substances. And these substances could be anything between alcohol, weed, so there's both legal and illegal drugs. It could be even over-the-counter medication, right? So you've heard of people who are addicted to Valium because they can't sleep, right? So that can quickly translate to substance use disorder, but it always starts with substance abuse. So you start from a point of abusing a drug, and then you slowly now grow to a point of chemical dependency. Without this drug, you cannot survive. You cannot operate at a normal.
And it's interesting because society kind of does like to categorize those who will start misusing or abusing something that perhaps is medical versus which is recreational. So it's kind of like, you know, you can't judge me because I'm addicted to like painkillers. But if you are on alcohol and cannot function without the alcohol, somehow your addiction is worse than mine. Wow.
And most of these things start slowly. They just start slowly. And that's, for example, if you look at the opioid crisis in America, most of these people, at one point or another, there was even a Netflix series about it. At one point or another, they got injured, they were put on an opioid. Then, because it's very highly addictive, slowly by slowly, they got addicted to it. So even beyond the pain, now you can't function with it. And not because you're so much so looking for the high, but because your body, you know what I talked about, chemical dependency, your body cannot function without it.
Okay. Just, you know, to put some context in, especially when we are tackling issues to do with mental health, we always like to highlight the importance of appropriate language or respectful terms. Let me tell you, I was just telling Kadambi before we started the show how confusing, how ever-changing these terminologies are, but I think this is why the experts are here in studio, so that we can actually get it right. The reason I say it's important to, you know, bring this up is because every one of us could perhaps be affected in some shape or form with someone who's in this space. So how do we go about relating to individuals like that? These things are very big, especially in the Western world. And so, Kadambi, tafadhali, how do we go about handling people with behavioral disorders? Examples of wrong terminologies that we tend to use every single day versus what's appropriate. And in this case, because now we're talking about substance use disorder, what do people commonly refer it to as and versus what is right?
Okay, so you've had, and this has been, it's a lot of times you don't say it in jest, you know, it's just loose talk. It's what happens. And so you'll hear, they're crazy, she's a junkie, you know, so and so is not normal. They killed themselves. They died. Because these days we don't say they committed suicide. We say death by suicide. So that then you're not, it's the disease that led you to do it. Committed suicide is like they committed murder.
Like the way you commit to get married, like you
purpose to do it, but that's not the case. The reason behind it is not with the aim of death. It's with the aim of ending the pain. We call them addicts. We call them alcoholics. But how we like to say it, number one is, even using the other one that I've seen that has become common is using mental health terminologies as a verb.
Okay.
Oh, I'm so OCD.
Right.
Oh, you know, I'm so depressed.
Yeah.
Yeah.
Hey, dude, by
the
the
weather
way,
is so bipolar.
Yeah. Okay, I won't even lie. Sometimes, yes.
Yes, even I am guilty of, you know,
Right,
some
you're like, hey, baby, my boss is bipolar.
Bipolar, yeah.
Right.
You know.
Right.
That one is too ADHD.
Yeah.
But now we have to start being sensitive, and the importance of being sensitive to how we refer to these situations is to end the stigma.
Right.
Because when you say it as they're an addict, or they're a junkie, or they're crazy, or they're mad, or they're psycho, there's a negative connotation to it.
Correct.
Right?
Yeah.
But think about if you die by, through a heart attack today. The question will be, what was the cause of death? They died because of a heart attack, or they died by a heart attack, or they had a diabetic coma, or so in mental health we are moving to that space.
Right.
So as opposed to saying that one is an alcoholic, Ama, you don't know so and so who has a substance use problem.
Yeah.
So we say they're living with a substance use disorder.
Living with a
substance use disorder. Or they were diagnosed with a depressive condition. Or they're what else? They are, yes, living with or diagnosed with.
Yeah.
It's safer, it's more palatable, it's more receptive, even to the person who has it. So if it's me talking about depression, I'll say, I've been battling depression for X amount of time. Or I've been battling bipolar, or I've been battling schizophrenia for such a long time.
And so words really do matter.
They do.
So it would either, does it determine whether someone will even seek treatment or shy away from treatment based on the way people talk about them? Okay.
Yes, and I've seen it a lot with my patients, depending on how I break the news of the diagnosis. So being a clinical psychologist, one of my fortes is being able to diagnose and come up with a treatment model. How I break the news about your condition, or it's not even your condition, it's a condition you're living with, is very important, is what will determine how you will receive it, and your level of adherence to treatment.
All right, moving on, now that we've kind of cleared the air about that, we want to understand how these two are linked. So when we talk about substance use disorder and the mental disorders, okay, you've kind of alluded to that, but where's the link?
Okay, so I said substance use disorder is a mental health condition. It's a mental illness, all right? However, the correlation between the two is that one can lead to the other.
Okay.
So you're living with a mental health condition can lead you to substance use disorder, or your use of substance use, or your substance use disorder could trigger a mental health condition. Okay. For example, I had a patient who presented themselves with attempted suicide. Okay. All right. And what we're told is he has been battling alcoholism for a while, and even when he attempted, he was high. So when I sat down with this man, I discovered actually what he was living with was schizophrenia.
Oh my goodness. Yeah.
So he was drinking to silence the voices in his head.
Because it was too much.
Yes.
Like he almost like felt like he was imploding.
Yes.
So for him, this was his therapy.
Yes. That was his coping.
Yeah.
And you'll see that tobacco use, cannabis use will be big with people who have anxiety. Yeah. People who have schizophrenia will also be there. ADHD are conditions that could easily drive you to calming. Yeah. The calming type of drug.
Right. Yeah. Right? And we see that. I mean, people tend to feel like, you know, even when they're seeking treatment, you know, when they talk about medicinal marijuana, what do they always describe that it does for them?
Exactly, it calms them down. Exactly.
Yeah.
But on the flip side, you being having substance use disorder can trigger a mental illness. Some of these medications can easily trigger psychosis.
Okay.
Right?
Yeah.
So, and the danger with it is you may be able to come back from the psychosis or not.
Yeah.
You understand? Things like alcohol are depressants. So we have substance use, substance-induced depression, substance-induced anxiety. So people who, whereas there are people who will smoke weed with the aim of calming them down, in fact now it worsens your anxiety.
Oh.
Because you're hearing and feeling everything on a higher decibel.
You're super stimulated.
Yes.
Yeah.
So that in itself can worsen the anxiety. So the two correlate. Again, at times it could be withdrawal from a drug that can trigger a mental health condition. For example, this we see especially with people who, which I have personally experienced, is someone who is withdrawing from alcohol. And so this specific person had an injury. They were admitted in hospital. So for the period of time that they're in hospital, it meant no access to booze, right? And then when they went home again, because you're on medication and everything, and you see, this is a functioning alcoholic. So in their mind, they're not thinking that I need a drink.
Right.
You're sleeping throughout because of the medication. So your thought of let me go look for a drink is really not there. So what ended up happening is this person started developing psychosis, what we call delirium tremens.
Oh, wow.
You're hearing things, you're seeing things. It's as if you have schizophrenia. Like you, and the treatment for that is you're rushed to the emergency room, and they have to pump you with certain medication to bring your brain back.
Right.
Otherwise, the delay of that could mean you're stuck in the psychosis.
Oh, wow.
Permanently.
Yeah.
The other thing is for some people who the drug triggers psychosis and they're able to come back, the likelihood of them developing a psychosis disorder in future is very high.
Wow. Do you feel that in, you know, just tying on to whatever you've just said, it's got me thinking about people who feel that they need to depend on, you know, things like marijuana and, you know, the whole push and pull. You remember the debate about why we should legalize, you know, marijuana because, you know, it's helping patients, especially those who are in the cancer space. But it seems to me, now I get it, why even health professionals are like, wait, hold up, let's test this a little bit more before we just talk about the benefits, but you're not looking at what could actually be the side effects of depending on that marijuana to calm the pain or to just ease the pain.
And marijuana is even not the latest that's being pushed. Psychedelic drugs are also, forget that. So your shrooms, I can't remember, the shrooms is one that's the most common, but again, there's a push to start introducing psychedelic drugs to treat depressive symptoms, to treat burnout, to treat just different mental health conditions. Now, ketamine has been approved because it's a medical drug and it has to be given by someone who's certified to administer ketamine as a treatment, right? Ketamine is already being used in the system for pain control and things like that. So it's also at the moment, I've seen it in Kenya. There are psychiatrists who are licensed to administer ketamine for depression as well. Okay. However, as you said, there has to be a weighing. Does the benefit outweigh the pros? Do they outweigh the cons, right? Because even for example, I'll keep using ketamine because it's what has been legalized, quote unquote. Before you start your ketamine treatment, there are 1,000,001 tests that have to be done. They have to check your kidneys, they have to check your liver function, they have to check your regular HB and things like that. And this has to be done also on a regular as you continue with, especially if you have a series of them. Let's say you've been you've been told that you have to do 6 rounds of ketamine for a period of on a weekly basis.
Yeah.
So every 3 weeks or every 4 weeks, they have to go back and check.
Wow.
Because it can easily mess up your liver, for example.
Yeah, yeah,
right?
yeah.
So I don't know. And not just with the illegal drugs, even with the legal ones, like alcohol.
Right.
So there are people who you'll find who alcohol has been prescribed. You're told take a shot or 2 so that you're able to sleep. But think about the long term.
Right.
So you'll take a shot or 2 today. In 6 months, will a shot or 2 work?
That's the thing. Now,
So
before you know it, you're already hooked. And this is the problem. I really like the angle that we have today. You know, this gives a different spin to mental health issues. And I love what Val is actually talking about in terms of how each could trigger the other, or the other could cause one to happen. And you kind of ask yourself, by the way, have I already started spinning out of control? It's a good challenge for each and every one of us, especially who are not even aware that perhaps our substance use could be leading to something else and we don't know, or we're trying to cover something that we're dealing with by coping, okay, with substance use. Why don't you let us know your thoughts through our social media platforms at K24 TV. As we take a break, when we get back, we're going to ask her to actually talk to us about the role of nature versus nurture. What's that all about? As well as understanding our role in terms of family and community support. That's also a very important angle as you're dealing with individuals, by the way, who are in this space and require the assistance, okay, and get onto that road of recovery. Stick with us, there's more to come.
Your Saturday morning won't be the same again.
Launch sequence activated.
Have a nice trip.
Oh, yes.
As K24 TV brings you Akili and me. Ubongo Kids, Next Generation, My World Kitchen, Muddle Earth, and MI High on Kids Zone from 7 a.m. to 11 a.m.